That is in the process. We are working with the school system as we right now, working with staffing it with volunteers and a nursing staffing agency so that we can begin that. The goal would be this month in January to begin that. Yeah, we're still working on all the specifics, but ideally you'd want to test those that are symptomatic and close contacts so they'd have a quick access to a test. Well, I definitely see that it will have an impact. I mean, there's lots of children in the schools, lots of staff. I do believe that the kids need to be in school. We just need to do it as safely as possible. Uh, so, I know that the schools are taking steps with masking, with, being very diligent in each school to keep the children, the staff, the faculty, everyone safe. But so it's going to be very important. And this is not only just to be diligent for the schools, but for our whole community to be diligent. This next month, through the month of January into early February, I think is going to be key as we work to get through this, and just really encouraging people to take, I know it's been a tough, long road, but really, focusing on things that we can do, wearing the mask, follow those 3 W's, staying 6 feet apart. And I think that what we're seeing now with this uptick is coming from two things. It's one, that Omicron is much, much more contagious. And then two, we've just come through a season between Thanksgiving, Hanukkah, Christmas, New Year's Eve, where there's been lots of people getting together and a lot of contact indoors. So, we've got to get through this period, obviously with kids being indoors, but taking those steps, number one being wearing the mask. But, I would encourage people to, whether it's your children or yourself, if you have symptoms, don't just assume it's a cold. It very well could be COVID.